Good evening, my name is Erich Schoeman. Welcome to Matters of the Soul, Soccer van die Siel. It's lovely to spend time with you. Yes, I'm busy tonight. I'm doing a live. I'm here with a Q&A on eating disorders. So I'll be chatting then and answering those. One of the questions that I have actually not addressed as of yet was how do you help someone who has an eating disorder, especially in your family, and I think that is very important. So there we have to actually understand a whole lot of things. So I'm going to try and answer that question, and it might take a while to answer that question because um, it's quite intense to answer that question. It's a long answer, so I'm not just going to answer that in a few moments. It's going to take some time to really give a thorough answer, and we'll almost set up a separate video with that question in mind. So how do you help someone with an eating disorder? But this is specifically for parents, family members, friends of a person who's worried. You're worried about that person, and you care about them, and you see that they're doing damage to themselves and to their bodies. And so it's something that is really of concern for you, and you would like to help, but it's not always so easy to help. Because your first step really in helping them is to educate yourself on understanding what an eating disorder really is and how it works. So you need to understand the basics of it, and but the more you can study it, and the more you'll gain empathy as well, because your understanding will enhance your ability to put yourself in their shoes and to not actually perpetuate the problem. So, and I will show you how to do that, because it is very important. So what you need to understand first of all is that an eating disorder isn't really about food and weight. It's almost like those are the fruits on the tree, but that's not really what it's all about. They are really, in essence, attempts to deal with emotional and stress-related issues, and mental or thought patterns, and coping with how they feel about themselves, what they think, and that's the core of it. It's important, obviously. One can't force somebody to change, but you can offer your support and encouragement, and encourage them to get treatment. So that's the thing. And through your comfort and your concern and your love, you will actually make a difference in their lives. So it is important for you to know that is what you can do. So okay, the reality here is that you've got to deal with how you understand it. So first of all, understanding eating disorders, and there I would recommend that you go to all my previous videos in this series. You can all find them on YouTube now, but they are under the video tab on Facebook, where I have a video on what is an eating disorder and how does it work, what causes it, how is it treated. And then we also have a video with Rodine Leidecker, a registered dietitian. I've got a testimony of a date boss who struggled with bulimia. So it's good to hear that from a person who struggled with it and is now at a totally different place. And then I've also got a discussion with my wife on revelation within, or thin within, a grace-oriented approach. She's gone through that herself, and the effect of that on her life and on your thinking. So go through those videos and have a look at that, and then you will have a clear picture on eating disorders. I'm also going to post an article soon, and I also have a video on women and weight issues. So just in general, those are not directed at eating disorders, but it's at women and weight issues. So if you have a look, and just for you in a nutshell to understand eating disorders, that it is extreme eating disturbances in eating behaviors. So there's a rigidity in following a certain eating pattern, a diet, and then there's usually some way of binging or overeating, and then and it's usually in secret, and like purging, they call it, it's throwing up after a meal. And obsessively counting calories and trying to manage the anxiety actually that they feel. And they want to. There's control. I just spoke to somebody today who struggles with bulimia, and it's about control. It's about controlling where they don't feel out of control of their lives. So, or it can go to the more anorexia type, where there's restriction of what they eat, and then restriction to the degree of severe weight loss, where it can actually get extremely dangerous. Now, anorexia next to severe opioid use or abuse is then the second largest killer of mental health disturbances. So it is extremely dangerous. But it is not just about the dietary habits and about eating and those things. There are actually at the center of this dilemma and this disturbance, there are incredibly harsh self-judgmental attitudes that criticize the self and about their weight, about food, body image, about themselves actually in general. And these negative thought patterns fuel all of this behaviors, and it is destructive, and it's quite dark actually, in a sense that it is hard living with that voice in your mind. So it's painful, and obviously they sit with a lot of shame and guilt, and they restrict the food, or they go into these rigid rules with how they should run a diet and how they should do this and that to maintain control over these painful emotions. And usually if you uncover those thought patterns, you get to the more deeper beliefs, or the core beliefs of being a failure, not being good enough, and it has roots in childhood, where you might have had some negative experiences with maybe your parents' style. And we're not bashing parents here. I'm one myself and far from perfect, so I understand that. But it is so they are trying to soothe themselves, actually the deeper emotions of sadness and anger and loneliness and those things. And the purging, so when they overeat, they try to soothe themselves, but when they purge, they're trying to actually fight the feelings of self-loathing and helplessness, but it's actually making it worse. So and then they start to lose perspective of themselves over time, and it becomes very difficult because the thoughts of food dominate their thinking. But at the core, those problems with thinking of themselves in a very judgmental way. Okay, so what's important is to also uncover how you see eating disorders, because if you have got to deal with the your own myths that you believe about eating disorders, because you have to understand that sometimes a person is not underweight at all and they have an eating disorder. You can even because when it comes in all kinds of different varieties, or they think only women and teenage girls suffer with this, but there are men as well who struggle with this. And it's not about vanity, it's not about their bodies, so it's not just about an obsession with being beautiful. It's with being good enough. It's fighting the shame and the pain and the anxiety, those things, or thinking that it isn't really so severe or so dangerous. It actually is. Even bulimia causes lots of physical problems, like dental problems, gastrointestinal problems. Your whole area that is involved in digesting your food from your mouth is affected. So it's very important to note that it can lead to more severe problems. So you've also got to understand the different types. There is also binge eating disorder, where people just compulsively overeat, but they don't purge. So they consume lots and lots of calories in a short time, and they feel guilt and shame over it, but they feel unable to stop it. So then they feel that all that shame, but they don't have the purging or the compensatory behaviors. Okay, so it's important for you to just understand the cycle there, and then the cycle in their mind. One of the cognitive behavioral therapy models explains this, just what is happening inside their mind. So they've got that, they actually base their self-worth highly on their eating habits, the body shape, and their weight. And the culture plays a role in this to fuel this. And they also look at their own ability to control their eating habits, their shape and weight. So, and that determines whether they are then good enough or in control. And if they're not in control of their lives, then it means they're bad or they're not disciplined. The lady today told me, then you're not disciplined. You're not, you've got a weak will. You're not strong enough in that sense. So you're not driving yourself enough. It's almost like you're lazy. You're weak. So, but it's as if the eating habits and shape and weight becomes exalted to that's your self-worth, forgetting about your sport, your spiritual life, your what the Lord says about you, what your family says about you, your work, your parenting role, your role as whoever, as a sibling, as a husband, wife. Forget all of those things, and it's just this. It becomes this enormous thing that you've got to. If you don't fix this, then you don't have self-worth. And then there's this. Then they go, okay, but then that leads to some strict dieting, and then they see food as either good or bad, and they get these sort of rigid things, and they call it clean eating, but it becomes extremely clean eating. And they try they're highly critical of their shape and weight, as you will see with anorexia, that they start to distort their perspective, but bulimia as well. You distort how you see. So something small, a small fault or imperfection becomes something massive. And then they're actually preoccupied with food and nutrition and hunger, and they start to break. Then they've got these rigid rules, but then they break these rules by binging. It's almost like they're deprived, and then suddenly there's this reward, and then but that leads to a lot of relief initially, because now you've got control. You've almost averted this crisis of picking up weight, and then but the problem is that does not lead to a pleasant outcome, because that just causes more problems, because now that leads to more self-criticism, and it's all or nothing thinking. Either you're good or you're bad. Either you get this strict dietary regime perfect, or you're bad, and then your self-worth is bad. So it's as if they're saying, I want to feel good about myself. The media and the world out there judges me based on my body, and if I don't meet these criteria, then I am a failure, and I've got to do that. So the way I can control that is by controlling what I eat and how I think. Well, actually, not how they think. They actually don't know how they're thinking. They think it's true and it's normal. Forget about that. So, and as soon as the binge is there to comfort them of all this anxiety and other stress in their lives, then they compensate with a vomiting or laxative or whatever it is to get the food out. And that brings relief and a sense of control, but it actually leads to more shame and guilt and a sense of helplessness, and it becomes worse. It escalates. Okay, so and then the anorexia is where they have this low weight and they've got to find control, and once they can starve themselves and lose weight, they feel a sense of achievement, and they develop this what they call starvation syndrome. So it's very intense, but all of these things then actually just confirm the fact that yes, your self-worth is based on your eating habits, your shape and size. Because if you can control your diet, then they feel a sense of achievement, and they wait. And if I can lose weight, I can sense I have that achievement. The binge eating person has some different things going there, that if they feel that almost like done in, and they need this reward, this comfort, and once they overeat, they just feel, oh, whatever, after I lost it, and they sense that helplessness, and but it's almost like they've got a stuff it attitude, and then they stuff themselves, and but it's much more. And I'm not trying to belittle it. It's quite hard actually, and they're stuck in that pattern, and it becomes a helpless, hopeless cycle. Okay, so knowing this, what's important for you then, once you understand all of these things, now I've now given a summary, is that if you are gonna give them a compliment, or you tell them, no, I mean, it's not true. You're not ugly. You're not this. You're not that. Yes, it is the truth that you're speaking to them, but initially they struggle to hear it. What they actually need, first of all, is a listening ear, an empathic, compassionate ear that says, please tell me about, I can see something struggling. I'm just walking alongside them and accepting them. If you remember from the previous videos, then it's about acceptance, it's about worth, self-worth then, eh? It's about being accepted as you are. But it's very difficult because there's a lot of resistance. Usually these persons have a lot of rigidity and they don't just accept inputs. I mean, I had an anorexia patient once forthright, openly tell me she's not going to change. She doesn't want therapy. The doctor sent it to me. She wants to be this. So she was very aggressive with that. But the aggression is masking some pain, but she was never not open to any inputs whatsoever. Okay, so, but if you pick up that their appearance will obviously start to show something, significant weight loss or rapid weight gain, or you'll see them, their weight will be fluctuating, or you see them disappear to the bathroom after meals, or you'll see their nails become brittle, or their breath is not good because and their dental problems, and lots of those things, and they do it in secret because it's quite a shame for them. They have this distortion then in between their real self and their self they show to others, and that also leads to guilt and those things, and a disconnect with people. Or they wear multiple layers of clothing to cover them, or they've got like marks on their fingers to show where they've touched their teeth actually. It looks like little cuts. And you will realize that they've got an obsession with what they eat. They eat only certain types of food, quite rigid about it. Or they'll make you lovely food, but they won't eat much of it or any of it. So it's about those things, and you'll see that, and then that gives you the signs that something is not like or they lose weight quite rapidly, and they use laxatives and diet pills and injections and stuff. Or they exercise compulsively, like the one lady that I saw, she exercised twice a day, but she did not, and she exercised a lot, but it didn't. You could see it didn't relieve any anxiety or those things. Okay, so a lot of that was intense, and then the I just lost my place here with my notes. Okay, so you'll see those things, or they'll be eating alone, or you'll find all kinds of wrappers and stuff in them stashed away. Or they'll be hoarding some food, high calorie foods. Okay, so what you do here is, what is important here is that you do reach out, because I mean, you might be afraid, maybe you're not right about this. Maybe you might be saying something that is upsetting to them, but you shouldn't. You should remember that if you voice valid concerns, I mean, you're trying to help that person, and that's the most important one. So they are sometimes so stuck in that they are actually in trouble, in a sense. When you listen to Odette's testimony, you can hear that she was not telling other people about this, but she was really in distress. So they are also struggling to get out of this and to talk about this. So talking about this and breaking the ice is a good thing. It's just remembering that they're struggling, they've got low self-esteem, and they're actually very ashamed. So we don't come with judgmental attitude, we come with kindness, So they do need treatment, and treatment helps, but they need intense treatment. It's not a quick fix. So what you do is you don't talk in a confrontational way, you talk in a loving way, you share why you're concerned about them, that you love them, that you care about them, that you want the best for them. And you obviously do this in private, and you try to remain in a calm, focused, respectful attitude during your conversation. Maybe they deny and they become angry and defensive, but just keep on being calm and just say, I can see that this is not easy for you to talk about, because they might not admit and open up in that conversation, maybe another one, because it gives him some food for thought. Excuse the pun. But it's difficult to know. They can't be forced to change. You're sowing some seeds and you're saying, I'm here for you. If you'd like to talk about it, I'm quite concerned. Obviously, if it's life threatening, you've got to say, listen, I've got to help you, and this is would you consider you're receiving help with for this, and because it's and if it becomes life threatening, you could say that it is. We've got to help you with this, and then it becomes a bit more serious. But they, if it's a teenager, obviously it's the same kind of a discussion, but they've got to know that you care, and that you want to help them here. So you don't want to criticize and accuse them and blame them here. Otherwise they just become more defensive. What you want to do is just talk about some behaviors that are specific that you point out that really causes you some concern. And what you want to do is you focus on your feelings and on the relationship and on your how you care about them, not on the weight and the food and stuff. You just say you've noticed those things. You can even say that you can share some things that you've noticed and where you feel concerned and that you think that these things may indicate that they need professional help. You can just imagine that they must be in distress and that you can think that this must be very hard for them and that you're concerned about their health. But you're not going to talk about this to other people. That's not your initial place. What you want to do is you want to reach out and just tell them that you're there. You don't want to tell them, listen, I'm so shocked, your body is so thin, you look so terrible. That's just perpetuating the judgment there, the self-judgment. Sometimes even a compliment about their weight and appearance just reinforces that obsession with body image and weight. I also talk about that in a previous video. So we don't want to tell them that, if you've already got a prejudice about weight and fatness and thinness, and I mean, you're thinking of, you've got to be thin to be beautiful. I mean, then you're going to convey that. If you say you're not fat, it's just going to actually just enhance that. What you rather want to say is you rather want to explore their fears about being fat and rather say, I can imagine that there must be, I can see that this is something that really worries you a lot, becoming fat. And you can maybe ask them, why would they like to be thin and what are they trying to achieve? But I think the main conversation here is to first reach out and to maybe try to hook them to get professional help, because we're trained to do these kinds of conversations. So you don't want to go into a big fight that becomes a power struggle, and that says they have to now change or else, or that you think that they are terribly looking after themselves, to induce them guilt. And because they already feel out of control and they're already dealing with the guilt. So rather what you'd like to say is, I'm concerned about you because you refuse to eat breakfast or lunch, or I saw you hardly ate something today or yesterday. Because I'll say, no, I had a lot of food to eat, or it makes me afraid to hear that you're vomiting and I can see that I'm thinking this must be really stressful for you. Or, you should just stop it, stop at therapy. Just don't oversimplify. And so rather reach out. What we want to do is we want to rather reach out and say, I'm here for you, I want to help you. Obviously, you want to avoid threats and scare tactics and try to be consistent. And if it's your child, you've got to say, listen, I want to work with you and I want to find out and I want to help you. Because many times the family system is part of the problem. There's stress in the system, there's rejection, they can't speak openly. So it's about feeling good enough about yourself. So what you want to do is you want to promote their self-esteem. All the different varieties of their lives, their intellect, their sports, their friendships. You want to encourage them and the idea is in the end they need to start to work with unpleasant feelings. But how you deal with unpleasant feelings is by finding a safe space to talk about it. So, and then for a parent, it's not your fault that they're struggling with this. I mean, the world's set up to almost geared to make us doubt about ourselves a lot of the time. So there's lots of messages coming their way. It's not just the message from the home. So it's important to also know that there's professional help out there. If you don't know how to do this, go and talk to somebody first and go and just find out what they say. Tell them all the stuff you're seeing and find out what the psychologists or the psychiatrists' idea is. What are they hearing, so that they can assist you, and maybe they can help you with a more accurate diagnosis and idea, and say, okay, let's maybe start here. Maybe start with the doctor first, and then the doctor, who's an authoritative figure, gives some kind advice, and then also, assists with maybe depression and anxiety that goes along with this. It's exacerbated by this, but it might go coincide with this. So knowing that there are lots of treatment out there, and then obviously you see the psychiatrist and the psychologist and dietitian, we work, and support groups work, and there's even inpatient facilities or residential treatment where they can be in a clinic where they can stay in, and that also helps. And you'll see that from Odette's testimony as well, where they get group therapy. So, and the idea with the therapy is to explore issues underlying that disorder, so the judgment, the self-worth, the rigidity, and learn more healthy ways, more balanced ways to approach food, that there's not such a rigid good and bad foods, that we can enjoy food, and to almost stop that compulsion that mimics an addiction, where you've got to have this and you've got to do that, and to start to deal differently with the deeper emotions that they're feeling, and to communicate those, and to connect with people in genuine relationships. So the idea would then for them be to also learn about real nutrition, and how to have a balanced meal, and have realistic dietary goals, and deal with the fear of becoming fat and what it says it's most self-worth, those things, and then those things. But if they are going to be hospitalized, if it's required, and it's usually required to help them to pick up weight and to break that cycle, if they're stuck in that severe binge purging cycle, or the restriction, and it becomes medically harmful, or they're finding that they're really so stuck they can't get out of this, the hospitalization helps them, and it helps with nourishment, and it helps with that, so maybe even suicidal behavior, or when they're really depressed. The antidepressants may also help to even relieve some of the binge purging, but it goes co-jointly with therapy. Obviously, you've got to take care of yourself as the family as well, and have patience with this process, and just walk alongside them. But you've also got needs, so sometimes you've got to get some distance, and just look after yourself, and then reach out for prayer groups and support where it's confidential, but it's got to be confidential, and you've got to ask for prayer, because it's but obviously that has to be handled with wisdom, with whom you speak, and because this is something that could also now perpetuate your family member's problem until they've decided to make it public and talk about it. Rather check with them and say to them, can I ask some people to pray for us, and some people that will respect the privacy, but also respect the confidentiality of it, because it's important. You also need that support, and maybe you need your own therapy as well, and guidance and support, because it's these are intense emotions that you might also sit with, and even some fears about the well-being of your child or your spouse. Because I heard about a lady who lost function of her kidneys and is now on dialysis, and it's due to anorexia. So it's not, it's very, it can become very severe. But you also need hope and encouragement, and then remember the small steps forward. That's where what you're going to see, and then we praise that person for that as well, and try to see. Also read up on stories of hope, people who have gone through this, and how did they get through that. So all of that helps you to maintain your perspective of hope, and to keep your hopes up. So I do hope that gives you some hope, and some guidance on this, so on how to support one of your family members when it comes to an eating disorder. Okay, yes, I think that's good enough. Many blessings, and have a good evening.